Hello and welcome to the ENT Academy teaching video. Today we're going to talk about tuning fork tests that you can perform in the clinic room, Weber's, Rinne's and Stenger's tests. We tend to use the 512 tuning fork. That's normally the one that you won't have in your tray because it's been nicked by one of the registrars. However, do try and find this. It's much better to use than the 256 or 128. For the Stenger's test, you're going to need two tuning forks of identical frequency. Rinne's test, first of all, bang it on your knee, not on the hard table. You want a single tone. You put it next to the ear and on the mastoid. In Rinne's test, it's normal if you hear the tuning fork louder next to the ear. That's Rinne positive. If you hear it louder on the mastoid bone, that's Rinne negative, and that can be a conductive hearing loss. Weber's test, the tuning fork vibrating, is placed either on the forehead or on the nose. Occasionally you can use the teeth, and either the patient will say they hear it centrally or they can't tell which side. If it refers to the right, there's either a right conductive loss or a left sensory loss. You can practice this by putting a finger in your ear and trying it on yourself. If we put the two results together, if Weber's test refers to the left, but they are positive Rinne bilaterally, then that would suggest a right inner ear weakness, a right sensory hearing loss. However, if Weber's test refers to the left and they're now Rinne negative on the left side, then this would suggest a left conductive hearing loss. Again, you can try this at home. One of the few experiments you can try at home. Stenger's test is a test for non-organic hearing loss, and I'll let you read the screen. If the patient has no hearing on the left ear genuinely, and you put the tuning fork next to the left ear, it will not mask out the sound going into the right ear, so they will hear the right tuning fork and they won't hear the left tuning fork. However, if they have a non-organic hearing loss on the left side, the tuning fork alongside the left ear will stop them hearing the tuning fork on the right side, so they will say they can't hear the tuning fork on either side. Note the tuning fork is much closer on the left side, so it gives a higher sound intensity on the left side, which blocks the hearing on the right side. This is it in practice. The lady is saying she can hear it on the right and not on the left. She should have her eyes closed for this test. I've now banged both tuning forks on my knee. I'm putting it closer to the left ear to mask the right side, and she's saying she can't hear a tuning fork on either side. As soon as I take away the left hearing tuning fork, she now says she can hear the right side. Thank you for watching.